couple of things that we learned from the pandemic. One, information's key. It's most critical. And in the beginning, we were scrambling to figure out what was going on a national basis and what was going on in the state.
This is such a profound event in the history of, certainly in the history of medicine, and in the history of our country and the history of the world as well, that there will be physicians and researchers and academicians whose remaining career will be coronavirus.
This is the first global pandemic, truly global pandemic. This has been the stuff of science fiction movies and books for so long about this virus that sort of sweeps across the world because of our globally connected world. And, you have breakfast in London and lunch in Paris and, dinner in New York, that kind of thing. Just how we became so vulnerable to what is, at the end of the day, a fairly simple but highly infective respiratory virus.
I think one of the most immediate challenges we had with the 12 people or so that we had was how do we conduct all these investigations that are coming in. When we had that first uptick in Lexington around the meat processing industry, I mean, there's hundreds of cases every day, which we have trained staff to do this, but we handle more typically 5 to 10 cases a day. Not 100 or 120 cases, which we experienced for about a week and a half. And so we had staff that worked, including myself, in excess of 100 hours a week for about 3 or 4 weeks.
I think immediately we were all monitoring it. But as I said, the acceleration that occurred with the virus moving across the country and then throughout Nebraska, we very quickly had to come up with solutions or a blueprint, a plan, what our actions would be. Always keeping in mind, first and foremost, the health and safety of our students and staff. And so we made the decision to close school for in-person instruction on March 13th of 2020.
I think that we really responded to the community's needs as we've done for nearly 100 years. But in this case, we were the first to bring convalescent plasma therapy to patients. We were one of the first to bring infusion therapy to patients. We provided nearly 5,000 masks free to the community at a time when masks were really needed. They still are today, but they are oftentimes in short supply. So those are just some of the ways that we did respond to the community's needs at this international pandemic time.
Virus has affected different markets differently, if you will. Our sports market is doing very well right now with wrestling tournaments, just getting into the wrestling season. The leisure travel has helped bring us up from being even down farther than what we were. The challenge that we have right now is the convention market. People just don't feel safe in large groups. It comes down to that, and it doesn't matter if you're a convention or a wedding or a special event in some situations. We just don't have that confidence level yet.
It's been about a year. I remember the phone call from Sherry at the Jubilee Center asking if we could possibly step in and feed some of the at-risk people. Our thought was, and hers as well, we'd do this for a couple of weeks until the pandemic calmed down. We showed up from the time she called me. I guess it took us 2 days to get the approval from Two Rivers. We kind of had to readjust the way we fed people. Showed up at the Jubilee Center our first day and we had about 200 folks.
We started to watch the headlines, whether it was the news headlines or the newspapers, and it felt like it was going to be on the coasts. And then the reality that it was coming into central Nebraska, it was almost shocking. I mean, it's almost like you were frozen and you wondered if it really was going to make an impact here, or was it just a bunch of hype? And then things started to close down and it just felt very real all of a sudden. And we were still reeling from the fact that we were dealing with flood victims from the year before. So we almost felt practiced in a weird way to react to an emergency like this. But at the same time, we're almost shocked because we were affected too. Everyone was affected. There's no way to get away from it. And so I would say yes, mid-March, we started to say, wow, this is coming to Kearney, Nebraska. It's everywhere, and this is going to be pretty serious.
Looking at it from the early days and looking at just the high infectivity that we were seeing very early back in March and in April, and also I think that there were a couple of assumptions that I made about infectivity and just the kind of spread and the kind of like strain upon the health system, especially in the initial days when we didn't know really how to deal with this and how do we deal with patients who are struggling and who are tanking because of COVID. I think that was a big factor in just how long the disease has persisted. But I'm frankly, I'm happy to be proven wrong. But I'd also expected that vaccine development would take, somewhere between 12 to 18 months. And in reality, we were able to bring a vaccine to the market in less than 10 months, which is astonishing. Just like that has never happened before. It was obviously a series of very fortunate coincidences, including, being able to use reverse RNA technology, based on previous research that we had with other viruses. But that has been such a pleasant surprise.
We have a large, bright light, glimmer of hope, maybe more than a glimmer. But at the same time, I think we have to remain cautious. We have to be on guard. But there's certainly much more optimism now with the vaccinations available and the number of people in our own county and surrounding area that have received the vaccine.
As I reflect on this last year, the thing that I'm absolutely pleased about is the flexibility, the resilience of our workforce, our physicians. We are extremely grateful for the community, how the community has reached out to us and taken good care of us while we've taken good care of them. We've had local businesses bring us food. We've had local businesses bring us personal protective equipment. We've had local businesses share emotional and mental support through thank yous. That's extremely important as we've dealt with this pandemic the last year. And as far as resiliency is concerned, I'm really proud of how people were able to handle the balance between personal and work life during all of this, and how we've really band together to take care of each other.
And we've tried to be very wise in how we are loosening our restrictions, and now we're on the cusp of spring break. Did we have some data or number of cases that in October and November that worrisome? Absolutely. And now with the onset of the vaccines, anyone in our school system as of today will be fully, or at least have the first shot of the vaccine. So the one thing that I've seen in the last few weeks, if not last couple months, has been that we have hope, and that was absent for a while. But we understood the important role that we played in this community. In order to have a functional community, we believed we had to be in person in order for parents to go to work. We believed that we had students that already had experienced a loss, and we needed to fill any of those learning loss voids.
I really look back at last year, I really think as a community within our 7 counties, we're stronger as a group of 97,000 people because we've went through this together. And sure, there's been a lot of challenges we've been through. There's things we can agree to disagree on. I think that's also fair to say. But we're still, we're communities that are intertwined. If you're from Elm Creek or Shelton or Alma or Ravenna, it doesn't matter. We're all related in some way. And it's interesting how closely sometimes we're related. So, but that being said, I just think it's so important to us be cognizant of how strong our partnerships are, how they continue to grow, and how we do rely so much upon others in everything we do every day.